Hi there, my name is Dr. Richard Mata, the creator of Patient Files. I would like to discuss to you today on how you could use patient files in recording your patients that are admitted. In my software, I made it to a point that you could record your patients separately, those that are outpatient and those that are inpatients, because it's confusing if you mix them all together, because sometimes you just want to browse those patients or how many times the patient was admitted easily and not being confused on a record that is just an outpatient. So we'd like to use the iPhone, although we could use the iPad version, but this time I'd like to demonstrate it using the iPhone version of the patient files. Okay, let's now open the patient files app, and then click OK to go to the list view first. So here we are now in the list view. If you're looking for a patient, for example, the name is Oliver Tebes, click on the space bar at the top, then just type the first letters, TEV, for example. So you could see the patient there, Tebes Oliver, just click it. Here you could see two buttons, the visits and the admissions. But now we're going to discuss on the admissions, so click the admissions button. Here you could see already that the patient was admitted for 3 times. There are 3 records already and there are different dates corresponding. You can click one record there to review. And then here you could see the date when the patient was admitted. Just click main button. Then you could see the patient had cough before, and this is the diagnosis as bronchopneumonia. Click the next arrow for the next record, previous record, and then you could click the main button again to know what was the diagnosis before. So the patient had LBM and also amoebiasis. Click the next button again, and then here this is the date of the admission, of the third admission of the patient. Click main and you will see the patient had fever and was admitted with dengue fever. So this is the history of the patient's admission. So click OK. So we'll go to the list view, and then you will tap the left lower corner for the new record for the admission now. No? So click the date of the patient when the patient was admitted. Okay. And then click the main button, click chief for the chief complaint, and then just type the first letter. For example, for fever, just type FE. Don't need to spell everything. Then go to the main diagnosis and go to the space search button, then type URI for urinary tract infection. So you don't need to type everything. Okay, so actually you're done, but if you want to add some more things here, you could add medicines that you've given. So go to the RX. You gave cefuroxime, for example, to the patient. Nebulization, for example, just for example, to the patient. So it's there. So actually those are, for example, the medicines you've given. So you're done. So you can click back and then click OK, and you're done. Okay, so I hope you learned something, and hopefully you're gonna open all my other emails so that I could teach you more of the other things that I need to share to you, so that it will benefit you and your patients as well. With that, have a nice day.